Bismillahirrahmanirrahim. Today our topic is lymphoid tissue. And we will discuss part 1 of this subject. Now we come to the introduction of the lymphoid system. The lymphoid system consists of tissues and organs mainly made of lymphocytes, which protect the internal environment of our body against invasion of microorganisms, and this protection is maintained by producing a specific immune response. The immune response is activated only when the first two lines of defense fail to prevent the entry of microorganisms. These first two lines of defense are, first we discuss the first line of defense, which is provided by the surface epithelium. This surface epithelium covers our skin and mucous membrane, and it lines the mucous membrane of the hollow visceral tracts, which are exposed to external environment. The antibacterial substance present in various secretions, for example, tears, saliva, etc., on the mucous membrane, and the acidic environment present in stomach and vagina inhibit the growth and entry of microorganisms into the underlying tissue. The second line of defense comes into effect when there is a breach of the epithelial surface due to injury. This second line of defense is constituted by phagocytic cells, which are macrophages and neutrophils. These are present in the connective tissue, that is lamina propria and dermis. These cells exert a non-specific cellular response by destroying the pathogenic bacteria by phagocytosis or by producing an antiviral substance, that is interferon, against multiplication of virus within the cells. The site where pathogenic insult is induced is called inflammation. The third line of defense is the specific immune response, which gets activated when both the above mentioned lines of defense fail to check the invasion of pathogenic organisms. The specific immune response is evoked by lymphocytes. Now we come to the lymphocytes. As you already know, lymphocytes are of two types, B and T. They are derived from common stem cells in the bone marrow. Though these B and T lymphocytes are morphologically similar, they are functionally different. B lymphocytes, here the B lymphocytes, these cells mature and become immunocompetent in the bone marrow, whereas the T lymphocytes, these cells mature and become immunocompetent in the thymus and migrate to other peripheral lymphoid organs. The defense mechanism mediated by B lymphocytes is called humoral immune response, in which the immunocompetent B lymphocytes encounter a specific antigen and become activated. When B lymphocytes are activated, they proliferate and differentiate into plasma cells. Now these plasma cells secrete specific antibodies that are called immunoglobulins into the blood and lymph against that particular antigen. The other mechanism, cellular immune response, is mediated by T lymphocytes with the cooperation of macrophages and is involved in direct destruction of the invading pathogenic organisms or antigen. T lymphocytes may also act indirectly by activating, first they activate B lymphocytes, then they will differentiate into the plasma cells and secrete specific antibodies. Now we come to the immunoglobulins. Immunoglobulins are circulating plasma glycoproteins secreted by plasma cells. They are called antibodies. They interact specifically with antigens, initiating a complex immune response that protects the body from damage. There are 5 classes of immunoglobulins which has been described in human beings. Number 1 is the IgG. This immunoglobulin, which is called IgG, is most abundant type, forming 75% of the serum immunoglobulins. This is the only immunoglobulin that crosses placental barrier. It protects the newborn against infection. Second is the IgA. It is the main immunoglobulin found in secretions, for example, nasal secretion, bronchial, intestinal, and vaginal, and other secretions like tears, colostrum, and saliva. It protects the mucous membrane and prevents the proliferation of microorganisms. It constitutes 10 to 15% of the serum immunoglobulins. Now, third one is the IgM, which constitute about 5 to 10% of the serum immunoglobulins. This immunoglobulin is found on the surface of B lymphocyte. It is the first immunoglobulin to be produced in an initial immune response. It activates complement system. Fourth is the IgD. It is 0.2% of the serum immunoglobulins. Its function is not completely understood. Like IgM, it is also found on the surface of B lymphocytes. And the fifth one is the IgE, which is 0.002% of the serum immunoglobulins. It binds to the surface of mast cells, eosinophils, and basophils. It participates in allergy and destruction of parasitic worms. Here is a table which shows percentage of B and T lymphocytes in various lymphoid organs. If we say bone marrow, it contains 90% B lymphocytes and 10% T lymphocytes, whereas in thymus, 100% is the T lymphocyte. In the lymph node, 40% B lymphocytes and 60% T lymphocytes. If we say the spleen, it has 55% B lymphocyte and 45% T lymphocytes. And blood, 20% B lymphocytes and 80% T lymphocytes. Now we come to the cells of the immune system. Cells of the immune systems are number 1, B and T lymphocytes. These are the prime cells of the immune system. Second are natural killer cells or NK cells. These are morphologically similar to lymphocytes, but functionally they are different. These NK cells attack virus-infected cells, transplanted cells, and cancer cells without prior stimulation. Number 3 is the macrophages. And macrophages and cells of mononuclear phagocytic system. Number 4, antigen presenting or APC cells. Here the examples are Langerhans cells in the epidermis, follicular dendritic cells in the lymphoid organs, and M cells in the epithelium of the ileum. Next are neutrophils, mast cells, and eosinophils. These were the cells of the immune system. Here is applied anatomy relating to this system. One of the primary causes of acquired immune deficiency syndrome, that is AIDS, is the killing of helper T cells by the infecting HIV. This suppresses patient's immune system and renders them susceptible to infection by microorganisms. Now we come to the classification of the lymphoid tissue. The lymphoid tissue is classified into two main types: diffuse lymphoid tissue and dense lymphoid tissue. In diffuse lymphoid tissue, it is constituted by a layer of diffusely arranged lymphocytes and plasma cells deep to the epithelium in lamina propria of digestive, respiratory, and urogenital tracts, forming an immunological barrier against invasion of microorganisms. Second is the dense lymphoid tissue. It is characterized by the presence of large number of lymphocytes plus few macrophages and plasma cells. These are arranged in the form of nodules. And these nodules are found either in association with the mucous membrane of the viscera or as discrete encapsulated organs. This dense lymphoid tissue, which has two presentations. One is mucosa associated lymphoid tissue, which is non-encapsulated, and other is the capsulated. First, we take non-encapsulated, which are malt or mucosa associated lymphoid tissue. In some places of the other above mentioned tracts, that is respiratory tract and digestive tract, the lymphocytes aggregate and they form dense lymphatic nodules or follicles in the lamina propria or submucosa. And this forms malt. These are solitary nodules. It may be aggregated nodules as in pile patches of the ileum, or lymphatic nodules in vermiform appendix, or as a ring, that is walled air lymphoid ring at the entrance of the pharynx. Now the second, discrete lymphoid organ, which are encapsulated. These include following organs. Number one, thymus, lymph node, spleen, and tonsil. Tonsil is partially encapsulated, so here it is shown that it is a part of the malt. Now we come to the general architecture of a lymphoid organ. The lymphoid organs consist of supporting framework, which is connective tissue, and parenchyma, which is composed of lymphocytes. The supporting framework includes the capsule that covers the organ at the periphery, and trabeculae or interlobular septi, which enters from the capsule into the organ carrying blood vessels and nerves. And second is the reticulum, which supports the cellular parenchyma. So the supporting framework is capsule, trabeculae or interlobular septi, and reticulum. And this reticulum supports the cellular parenchyma. Now we come to the thymus, the first lymphoid organ. The general features of the thymus are: it is a central lymphoid organ. It is responsible for development of immune system of body and is essential for growth and development of other lymphoid organs. The thymus is a bilobed organ, the lobes being unequal in size. It is present in the superior and anterior mediastinum of the thorax. The thymus has dual origin. Its lymphocytes arise from mesoderm, whereas the epithelial reticular cells arise from the endoderm of the third pharyngeal pouch. So it is called as lymphoepithelial organ. Thymus is larger and well developed in fetus and in early childhood. It attains its peak development at puberty, and thereafter it starts involuting and is replaced by fibrofatty tissue. Its weight is maximum at puberty, that is 30 to 40 grams, and then it reduces in its weight. It has only efferent lymphatic vessels and no afferent lymphatic vessels. Now we come to the components of the thymus. First is the supporting framework, and second is parenchyma. The supporting framework of the thymus consists of number 1 capsule, number 2 interlobular septi, number 3 cellular cytoplasmic reticulum. This reticulum is formed by the epithelial reticular cells. If we see the parenchyma, it consists of cortex and medulla, and here in medulla are hazel corpuscles. Now we come to the supporting framework, which consists of capsule and interlobular septi. Here we see the capsule, and from this capsule these interlobular septi arise. This thin connective tissue capsule covers the thymus completely, and this capsule sends septi into the interior and divides the lobe into different lobules. But mind it, these lobules are incomplete lobules. They are interconnected with each other, and these interlobular connective tissue septi carries blood vessels, nerves, and lymphatics. If we see each lobule, it has dark stained cortex, this is cortex, and lightly stained medulla in the center. As already I have said, medulla of one lobule becomes continuous with the medulla of the neighboring lobules. This picture is of thymus. The identification points here we can see easily: dark staining cortex, light staining medulla, and in the medulla is a hazel corpuscles. These are the septi. This is also septum, interlobular septum. This is a magnified picture which shows thymus, capsule, cortex, dark stained, medulla, lightly stained, interlobular septi having blood vessels, nerves, and lymphatics. Now we come to the cellular cytoplasmic reticulum or epithelial reticular cells. If we see in this picture, these are the epithelial reticular cells, and these are cytoplasmic processes of this cell. Here is another cell. The cytoplasmic processes of one cell, they are connected with the other process of the other epithelial reticular cells, and they contact with the neighboring by desmosomes. This shows desmosome. Here is desmosome. This is the connection of process of one cell with the process of other cells. The supporting stroma of the organ within the lobule is formed by epithelial reticulum. This is the supporting stroma, which is endodermal in origin. These cells are stellate cells, as we see star shape. Thus, they form a cellular cytoplasmic reticulum. This gives support to the lymphocytes of the thymic lobules. These are the lymphocytes, or here we can say thymocytes. And this epithelial reticular cell provides support to these lymphocytes. Remember, this reticulum is different from the reticulum of other lymphoid organs where it is found by reticular fibers. But this is a epithelial reticular cell, not reticular fibers. Here we can see that they can be easily identified by large pale staining oval nuclei. This is pale staining oval nuclei and eosinophilic cytoplasm. The cytoplasm of the epithelial reticular cell contains secretory granules which are believed to liberate hormones. The hormones produced by these granules are thymosin and thymopoietin. There is another picture which shows relationship between epithelial reticular cells. These are the epithelial reticular cells at the periphery, and they are processes which provide support, and thymus lymphocytes. These are the thymus lymphocytes. Here is desmosomes, which is junction between the cytoplasmic processes of the epithelial reticular cells. Now we come to the lobule or parenchyma of the thymus, which consists of cortex and medulla. First we take cortex. Each lobule shows darkly stained cortex and lightly stained medulla. The cortex is densely packed with lymphocytes and few macrophages and epithelial reticular cells. And this is surrounded by process of epithelial reticular cells which help segregate thymocytes from the antigen during their maturation. So these epithelial reticular cells, actually they protect the thymocytes or lymphocytes which are going to be mature. They migrate toward the medulla as they mature. However, most T cells die in the cortex and are phagocytosed by macrophages. The surviving T cells are named, they leave the thymus and are distributed to secondary lymphoid organs by vascular system. Now we come to the blood-thymus barrier. This barrier exists in the cortex only, making it an immunologically protected region. Second point, it ensures that antigen escaping from the bloodstream don't reach the developing T cells in the thymic cortex. And this blood-thymus barrier consists of following layers. Number one is endothelium of the thymic capillaries and associated basal lamina. Second is perivascular connective tissue and cells. These cells, for example, pericytes and macrophages. And third is the epithelial reticular cells and their basal laminae. Now we come to the medulla and hazel corpuscles. Medulla, as we see in the picture, medulla is the lightly stained area. In the center, this is lightly stained because mature T cells are less densely packed. Here in cortex, these lymphocytes are densely packed, but in the center or medulla, they are less densely packed. For this reason, the epithelial reticular cells in the medulla appear to be numerous. This is opposite to the cortex. In cortex, epithelial reticular cells are less, but in the medulla, epithelial reticular cells are numerous. The most characteristic feature of medulla is the presence of hazel corpuscles or thymic corpuscles. These are the hazel corpuscles as we see in each medulla. These Hazel corpuscles actually are rounded laminated acidophilic bodies. They have central homogeneous hyaline material which is surrounded by concentric layers of flattened epithelial reticular cells. These cells are filled with keratin filaments. And one important property of this Hazel corpuscle is that number of Hazel corpuscles increase with age and may show traces of calcification also. And their function is unknown and are the last one to undergo involution. This is the magnified picture of thymus gland. Here we can see the capsule, outer covering, and from this capsule, this trabeculae or interlobular septi. This darkly stained area is cortex, in which lymphocytes are densely packed, and the epithelial reticular cells are less densely packed. Next, we can see blood vessels. These are present in these septi or trabeculae. Now we come in the center. This area is medulla, and it contains thymic or Hazel corpuscles. Here, these vacuoles, these are the adipose cells. Empty spaces, these are adipose cells. This is a whole lobule. Here also thymic or Hazel corpuscles. This is connective tissue which forms trabeculae. These are also adipose cells. This is medulla. This is medulla of one lobule, and this is medulla of the other lobule. Both are uniting with each other. They are continuous because these septa, they not completely separate each lobule. This is cortex. These are the blood vessels. Now we come to the characteristic features of the thymus. By these characteristics, we can differentiate it from other lymphoid organs. As we know, this is central lymphoid organ and is essential for development of other lymphoid organs. It has dual origin. Its lymphocytes are take origin from mesoderm and epithelial reticular cells from endoderm. Supporting framework is found by the cytoplasmic reticulum, which is derived from the epithelial reticular cells. The thymus formed only by T lymphocyte, which are called thymocytes. There are no B lymphocytes. It is divided into lobules of lymphoid tissue by interlobular septum. It has Hazel corpuscles. It produces many thymic hormones. It is fully developed at birth, and it involutes after puberty. Lastly, we come to the functions. As we know, it is a central lymphoid organ. It is essential till puberty for development of immune system of the organism. After puberty, the other lymphoid organs of the body are fully developed, and therefore it undergoes involution. If we remove the thymus in newborn, there will be failure of seeding of other lymphoid organs with immunocompetent T cells, which lead to deficiency in immunological competence to fight the invading pathogen. Infection will develop, and which leads to death. The epithelial reticular cells of the thymus secrete hormones like thymulin, thymosin, thymopoietin, which are involved in stimulation, proliferation, and differentiation of T lymphocytes. Thymus produces immunocompetent T lymphocytes, which are involved in cell-mediated immunity. Thank you.